Dr. Victoria Clare, the sculptor behind this show, in Wakefield, this new exhibition in Wakefield. Tell us about it, because it's an exhibition with a difference, isn't it, Victoria?
Hello there. We finally got there. Thank you so much for having me on the show. It's an absolute honour. Yes, this show is a very conceptual, a very unique show that has kind of come from 2018 when I put it on the first time. So in its first show, it's called Blind to Sixth Sense, and it was on in Herne Bay in Kent, which is where I'm from. And basically it was about a celebration of my own independence, of finding my autonomy and my freedom through using my mobility cane. But I wanted to articulate those celebrational feelings through my sculpture, which has kind of been something that obviously I've done over 3 decades now. So, and it's an evolving piece. So now it's changed to the sense of sculpture. As a PhD student by professional practice, it's got a lot more of research and academic tone to it. But it's really just to invite the sighted world to engage in 3 core principles. Those principles are as follows. So it's perceive through your other senses. It's engage through your body, and it's give meaning through our visceral, emotional sense. So it's trying to join those 3 core principles together to create a much more human existence within not just arts and culture, because that's really just a vessel for people to engage, but actually to engage with themselves, each other and the environment.
You said it's a sort of celebration of you finding independence.
Yes. And
it's interesting, that word celebration, because you're now registered blind, but you weren't always, that wasn't always the case.
No.
Some people would struggle to kind of imagine, using the word sort of celebrate at all when it comes to disability, losing something that you had and having to adapt to that. But I find it really interesting that you've used that word. So talk me through the journey. So you weren't always blind, presumably as you lost your sight, that, the word celebration must have been very far from your mind.
Yes, indeed. I was 19 when I was first diagnosed with a retinal condition called retinitis pigmentosa, which is a genetic disease of the retina, and it is a progressive condition. So as you can imagine, when you're 19, it's a pivotal point of your life. I had the gateway of the rest of my life to go through, and then all of a sudden this trauma hit. And that's what it is. It's a loss, it's a trauma, and it's a progressive and repetitive trauma at that, because every time you lose a little bit of vision, you adapt to it, of course you do, but then further down the line, you can't tell how far down the line, and the next kind of deterioration takes place. So there you are in almost like a post-traumatic stress situation where you're having to constantly adapt to a repetitive trauma. So that was very difficult, but as I've sort of said through this journey, I am so grateful that I had my artistic integrity, my love of sculpture, because my love of sculpture has been the way of which I've articulated my internal feelings about losing my sight. And as time has gone, even though I've, now lost my vision, I feel like I've gone beyond vision and I have gained so much more.
It's really interesting hearing you talk about that, because so many people listening will have experienced something or will be going through some kind of loss in their minds maybe now of physical function, because that's often what happens. Even if you don't have a condition like yours, as we age, certain things that worked in a certain way stop working in that way. But that kind of turning it to actually, it sounds like in many ways you sort of reframed it, that you've actually gained something actually. And I think that's a really powerful message to send out to everyone.
Yes, in my mind, not just through my my educational work as a lecturer of the University of Greater Manchester, not just as an advocate for the blind, and certainly not just as an artist over 30 years, but as a person, as a human being. I use these vessels for which, my career has taken me in a direction, as a platform to advocate the fact that, trauma, blindness, whatever your adversity may be, doesn't have to be a deficit. If we can just embrace it, if we can lean into it, there will be a pathway through it. I mean, as an educator and a student, I'm embracing such a thing as post-traumatic growth, which believes in resilience and the strength of the human nature. And I think if we can just lean into those core principles, then we can get through things, and we will learn more about ourselves and enrich our lives even deeper.
Of course, Victoria, normally if I was talking to sculptor, I would be asking them, what does it look like, the piece of artwork that they've created. Do I ask you how it feels? What's the experience of being around the work that you've done? How do you experience it, and how do you expect other people to experience it?
Yeah, I experience it in a very sensory, visceral, and yet bodily manner. So obviously, I started young as a sculptor, losing my sight whilst I was sculpting. So, my style of sculpture, for example, is very stylistic. The great late Henry Moore and Barbara Hepworth, who I studied deeply at art college, that style of symbolism is what my sculpture represents. And it is tactile, extremely tactile. So the fact that is how I create my work, through my tactility, is also how I want people to engage with the medium of sculpture, because after all, sculpture is, it's born from the place of, people have created sculpture through their tactility, and that's how I want audiences to engage with it as well. And of course, that's a hard kind of thing to break now, because all of so many galleries and museums,
you're not supposed to touch anything.
Yeah, don't allow you to, and this is part of the core principle again, that this exhibition, I want to break down those barriers, because it doesn't allow inclusivity within arts and culture. Many of us can't actually, engage with art because of those restrictions with which they put around them. So, it's about changing the attitude within arts and culture.
It's really, really good to talk to you. I think it sounds absolutely fascinating, and I love the idea of artwork that we're able to touch and experience with different senses. So congratulations. Yeah. Thank you so very much, Dr. Victoria Clare. It is open from today through October, the Sense of Sculpture at the Art House in Wakefield. It sounds absolutely incredible.